If you receive a letter from the Social Security Administration, do not ignore it. This is serious business. This letter is letting you know of a big policy change that already happened on March the 27th that you need to be aware of. I'm going to walk you through the details of this big change that the Social Security Administration has already made to their policy. And then there is more coming. On April the 14th, the Social Security Administration is rolling out yet more policy changes that's going to affect all beneficiaries, specifically people who are applying for Social Security benefits and those who are currently on Social Security that need to make changes to their benefits or need to update their information. So let's get started about these increase in changes that the Social Security Administration is making that sometimes they are not even letting you know by mail. I am Kwame Kwade. I am an entrepreneur and personal finance expert. I have been creating content for 15 years, helping seniors get the retirement benefits they deserve. I started creating websites on Social Security, food stamps, Medicare, Medicaid, and recently we have also added video content, which is why I am here. And I am also an adjunct professor. I teach entrepreneurial finance at one of the most prestigious universities in the United States. If you are new here, please hit the like button, hit the subscribe button, because we appreciate your support. And as always, as I like to do, I want to know where you're watching this broadcast from. So let me know in the comments your city and your state, and then let's get started. So, what is this huge policy change that is coming up? Well, if you get a letter in the mail from the Social Security Administration, pay attention because there's a lot happening right now. And this letter is going to give you information on a critical change that the Social Security Administration is making. So, the Social Security Administration is sending letters to beneficiaries who were overpaid, notifying them of the need to repay excess funds. These letters explain the new repayment policy that went into effect on March the 27th. Why are you receiving this letter? Well, overpayments occur when the Social Security Administration pays more than it should. So basically, it pays you more money than you should have received, often due to unreported income changes or calculation errors. The letter outlines the amount you owe and the options you have to pay the money back to the Social Security Administration right away. For overpayments that occur after March the 27th, the Social Security Administration is going to withhold 100% of all your future Social Security benefits until the balance that you owe is paid back. This replaces the current policy that only withheld 10%. So, what should you do? Well, I'm going to explain in detail what this is about and the options that you have to fix this if you get one of these letters. So, what is overpayment? Overpayment occurs when the Social Security Administration pays beneficiaries more than they are entitled to. As I mentioned earlier, is often due to income changes that were not reported by beneficiaries or calculation errors that the Social Security Administration makes in calculating your benefits. Now, when it comes to mistakes, even if it's not your fault, you are still responsible to pay it back. So, from 2015 to 2022, the Social Security Administration made nearly $72 billion in improper payments, primarily overpayments accounting for less than 1% of total benefits paid during that period. So, of all the benefits they paid from 2015 to 2022, they made 72 billion in improper payments, primarily in overpayments. So, currently, right now, as we stand, the Social Security Administration has yet to collect $23 billion of those overpayments back. That is why they're stepping up collection by changing the rule from only collecting 10% from your Social Security paycheck to 100%. Basically, they're going to suspend sending you your Social Security check until all of the overpayment is recovered. Overpayment recovery policies impact millions of beneficiaries, potentially causing financial hardship for those relying on Social Security as their primary source of income, and 40% of all seniors rely on Social Security as their primary source of income. So the policy change, as I mentioned, has already happened. It happened on March the 27th. Now they're catching up and sending you the letter. So if you get the letter in the mail, pay attention to it. SSA now withholds 100% of all your future benefits until your overpayment is fully repaid. These will affect people who currently have new overpayments. Those affected will receive no monthly check until their balance is resolved, creating significant financial hardship for many seniors and people on disability benefits. And then let's look at SSI exception. If you're on supplemental security income, you are exempted from this 100% policy. You are still going to be paying the money back, but they are only going to take 10% back. Social Security Administration sends overpayment notices at least 30 days plus 5 mailing days before starting the recovery steps. So things begin to happen very quickly once you receive that overpayment letter. So you cannot ignore it. You cannot wish it to go away. You have to confront this because it could jeopardize your benefits. So how do you respond to overpayment notices? Well, beneficiaries can repay the money back by credit card, online bill pay, or a check. You can contact the Social Security Administration by phone for assistance or visit their website for details. The image you see on the screen is the page on the Social Security Administration website that instructs you on how to pay back any overpayment you owe. Recipients can appeal the decision or the amount of the overpayment if they believe it is incorrect or unfairly calculated. Appeals must be filed promptly after receiving the notice. The notice you're going to get is going to tell you how soon you should appeal. Now, here's the thing. It will tell you to appeal within 60 days, but the Social Security Administration can start collection action within 30 days after they send you the notice. And so if you want to stop collection activity until your appeal is reviewed, you should send your appeal in within 30 days of receiving an overpayment notice. And this is something that they don't tell you, but then they will say 60 days and then they will start collection activities, including stopping your future payment. Monitor your benefits closely and report any changes in income, marital status, or resources to avoid future overpayments. And this specifically applies to people who are on disability benefits that are working or have income or situational household changes, plus people on Social Security retirement benefits who are collecting benefits before their full retirement age and are working and are making money that is over the earnings limit. So those are the two categories of people that generally end up with overpayment situations. Why is Social Security changing this policy from the 10% to 100%? Well, the stricter recovery policy aligned with President Trump's initiative to cut federal spending through the Department of Government Efficiency, DOGE, led by Elon Musk. SSA estimates recovering $7 billion in overpayment funds over the next decade under the new policy. This move is intended to safeguard taxpayer money and improve trust fund stewardship. The Social Security Administration also is cutting workforce by more than 12%, eliminating 7,000 jobs and closing field offices, which is also going to be a big problem. Now, let's take a step back. The full withholding policy was previously used when the Obama administration was in office. So when President Obama was in office, he was doing the 100%. And then it got a lot of pushback. So during the Biden administration, it was changed to 10% after the Social Security Administration got a lot of heat from Congress about it. CBS 60 Minutes did a story that shed light on how people's lives were being destroyed by this 100% policy that forced the Biden administration to change the policy to 10%. Now President Trump is moving it back to 100%. How do you avoid overpayment? Well, if your monthly benefit increases unexpectedly, contact the Social Security Administration to verify the reason behind the adjustment. Don't just take an increase in your Social Security benefits for granted and think that, oh, you have lucked out and you're going to just keep quiet about it. It may be a calculation error and you may have to pay it back later. So when you get a gigantic increase outside of your cost of living adjustment, make sure you understand why before you start spending that money. Report any changes in income, marital status, and resource promptly through the My Social Security account online or call the Social Security Administration. Accurate records reduce errors in benefit calculation. And then understand your eligibility rules. Familiarize yourself with Social Security rules for the benefit type that you're on. Retirement benefit, disability, SSI, all have rules about things that you have to report that affect your benefits. Income changes, marital status changes, and household situation changes, especially if you're on SSI benefits. That is very important. And then proactively communicate with them and let them know. Regularly check your Social Security statement and reach out to Social Security Administration with questions about payment accuracy or eligibility requirements. Now, if you are being impacted financially by this new policy, you can reach out to the Social Security Administration and tell them that you cannot pay it and request a waiver. They rarely grant those waivers, but it's worth the shot. And then if you cannot fight by yourself, get advocacy group. There are Social Security advocates that can help you prepare a good case and present it for an appeal if you are struggling to fix this issue because your money has been cut off and you're struggling to live financially. As I mentioned, there was previous public backlash that led them to change the policy. So maybe if enough people make noise, this 100% policy may be scrapped and returned to the 10% policy. And take action early. If you receive an overpayment notice, act quickly by appealing or requesting a waiver to minimize disruption of your financial stability while resolving repayment issues. As I said, you have 30 days to stop any collection activity. After 30 days, the Social Security Administration will begin to collect, including suspending your Social Security or disability SSDI payments until all the money is paid back. Let me know what you think about this overpayment issue. Do you think the 100% policy is fair? Do you think President Trump moving the policy back to 100% was a good idea? Let me know your thoughts in the comments. If you've been impacted by overpayments, let me know how you're dealing with it or how you were able to resolve it. Did you appeal? Did you get a waiver? What happened? Comment below. Now, as I mentioned, there's more changes that are coming as of April the 14th, and they haven't sent letters out for these. So I'm going to let you know what's happening so that you're informed and are prepared. So the Social Security Administration is making major policy changes as of April the 14th. They were originally going to do it on March the 31st, but they got some pushback from advocacy groups. So they pushed it to April the 14th. It is a new ID rule. They are pretty much eliminating a lot of things you could do over the phone when you're applying for benefits or when you're making changes to your benefits, and they are pushing it online. And if you cannot verify your identity online through the new methods that they have implemented, then you have to go to the Social Security office in person. So that's the new change they are making. So, what are these in person verification rules? Well, retirement and survivor benefits applicants must verify their identity in person if unable to do so online. This requirement aims to reduce fraudulent claims, but also could place burden on those without internet access or those who have difficulty traveling. And I already mentioned the overpayment policy that has already happened. We've already been talking about COLA that happened earlier. And then the biggest thing that is also happening is the staff changes. They're cutting Social Security staff at a record rate at the same time when there's record number of people collecting Social Security and disability benefits. It does not make any sense whatsoever. People are going to Social Security offices and waiting a long time to get services. People are waiting over the phone for 2, 3, 4 hours, sometimes calling multiple times during the day at different times trying to get somebody on the phone without success. So who is affected by these changes that are happening starting on April the 14th? Well, those applying for retirement benefits or auxiliary benefits like survivor benefits must verify their identity in person if online methods fail. The new rule adds a layer of complexity, especially for those who cannot verify their identity online. And SSI beneficiaries are also going to see a lot more scrutiny due to redetermination. Doge, headed by Elon Musk, have been pushing the Social Security Administration to investigate disability claims more, because they have this belief that a lot of disability beneficiaries are not actually disabled or are not currently disabled and are still collecting benefits. So Elon Musk and his team are pushing for more redetermination. So if you are on disability benefits, whether it's SSI or SSDI, expect more scrutiny. Now, who is not affected by these ID rules? Well, if you're on Medicare or applying for Medicare, if you are on disability, SSI or SSDI, or you're applying for benefits, you do not have to verify your identity online. And then, as I mentioned, if you're on overpayment or you're currently on overpayment, you don't have to pay the 100%, or you are not impacted by the 100% policy. You only have to pay 10% if you're already on a payment plan. But starting March the 27th, if you get a letter telling you owe overpayment, your benefits are going to be canceled or suspended until you've paid everything back, and then they'll resume paying you your Social Security or disability benefits. Now, survivor beneficiaries are going to be exempted in the future. That is something that's been discussed. So, further exemptions may be announced for elderly surviving spouses filing for survivor benefits. The Social Security Administration is considering expanding the exemptions to further minimize disruption to vulnerable populations during these times. Now, let me make this clear. If you're currently on Social Security benefits and everything is good with your benefits, you don't need to change your direct deposit, you don't need to change your address, you don't need to change your contact information, and everything is good with your benefits, then these new ID rules do not apply to you. But if after April 14th you have to change something about your benefits, your direct deposit information, then you are required to verify yourself online through the new process, either login.gov or id.me. Those are the two ways you can verify yourself online. If you cannot do that, then you have to make an appointment to the Social Security office in person in order to do that. Now, when current beneficiaries must visit the Social Security office, so if you are receiving Social Security benefits, what are the circumstances under which you have to go to the office in person to make a change? Well, the first one is direct deposit. Starting April the 14th, current beneficiaries who cannot use the online system have to go in person to make a change to your direct deposit information. Now, if you received a letter to verify your identity online and you cannot do so, then you have to go to the office. And as I mentioned, people on disability who are applying for disability or Medicare do not have to comply with these new ID rules. And if you need help, make an appointment in person at the Social Security office to get your identity verified. Now, how can you avoid being impacted by the new rules that are going into effect on April the 14th? Well, it's to create a Social Security account online. So go to ssa.gov/my account to access and manage your benefits digitally, reducing the need for in-person visits. You can use the login.gov or id.me to verify your identity online so that you can access your benefits online. And then if you need to update your information, do it now before April the 14th, because after that, you would have to comply with the new rules to verify yourself online to say you are who you say you are before they will allow you to access your information online to make any changes. If you want to make life easy for yourself, opt in for online notices so that you can get information quicker to avoid having to go to the Social Security office. Now, what action should you take before February the 14th? Why do I keep saying February the 14th? April the 14th. Create an account online if you haven't done so already. Update your direct deposit information before the new policy goes into effect. If you need to go to the Social Security office now, schedule an appointment soon, because after February 14th, after April the 14th, a lot of people are going to be hitting up the phone number to schedule in-person appointments. Remember, you cannot walk into the Social Security office anymore. You have to schedule an appointment to go to your local Social Security office. And so if you have any business to do there at all before April the 14th, go do it now. Schedule an appointment, because after April the 14th, there's going to be a lot of people calling and making an appointment. And if you are frustrated and cannot get help that you need from the Social Security Administration, call your elected representative, your congressperson, your senator. Let them know of the problems you're having with the Social Security Administration, and they can write them a letter on your behalf to get things rolling on your behalf. Social Security Administration responds better when they hear from people from Congress, because they know there's going to be some heat applied if they don't respond quickly to a letter from a senator or a congressperson. We've already talked about overpayments and how that is a change in policy. If you get that letter in the mail, do not ignore it, because this can stop your payments and affect your financial situation immediately. And then, as I mentioned, if you're on SSI benefits, expect more scrutiny. If you're on SSDI benefits, expect more scrutiny after April the 14th, because they are going to be making sure that those who say they are disabled and are getting disability benefits are really genuinely disabled and are eligible and deserve the benefits they are receiving, because they want to make sure that they're rooting out fraud, waste, and abuse from the Social Security system. So let me know what you think about these new changes that are happening. What do you think? Do you think they're just intended for what they are meant to be, which is to eliminate fraud and waste? Or do you think there are extra burdens that are going to be placed on people on Social Security and disability benefits that are unnecessary and are just going to frustrate people who do not need the extra pressure, who are already struggling financially? Let me know your thoughts in the comment section below. Now, if you're turning 65 years old soon, or you're currently receiving Medicare benefits, I have great information for you. There's been a lot of activity going on about people losing their Medicare benefits, and the headlines from some states are even scarier, like this one from Oregon and Minnesota, where people are losing or being dropped from their Medicare benefits. And so I have some news for you. 34 million seniors in Medicare Advantage face a rude awakening, because there's so much going on in terms of changes to Medicare plans that seniors do not know where to turn. Well, I have help. 24,000 Medicare plans are out there, and you're supposed to figure that out on your own. Figure out what plan fits you, your budget, and the medications that you need, the coverage that you need. Well, for that reason, 90% of all seniors are in the wrong Medicare plan, because finding the right plan that fits your budget, the coverage you need, can be frustrating with so many options, so many restrictions, and of course, cost that you have to factor in. And that could cost you your money, to cost you your health. The average senior couple spends about $300,000 on Medicare during retirement. So, how can you get help that can really help you figure this out? Well, we have partnered with Chapter Medicare. These guys are the real deal. And how the company got founded was one of the reasons why I wanted to partner with them, because one of the co founders was frustrated with his own parents and their experience with Medicare. And so he figured there's a better way. There must be a better way to do this. So they created Chapter Medicare, an unbiased free service that helps you sort through these 24,000 Medicare plans that are out there and help you get the plan that fits your needs. And here's the thing, Chapter is the only Medicare advisory company with access to all 24,000 plans. So they see everything in your local area and they can find the plan that fits your need. And here is one advantage that they have that I think other companies do not have. Their agents, their licensed Medicare advisory agents, do not work for commission. So when they're on the phone with you, their sole purpose is to help you find the best plan that fits your need, your budget, the coverage you need, the doctors you need in your network, etc. And they can save you a lot of money, $1,100 a year. So if you're turning 65 and need to sign for Medicare, or you are already on Medicare and need to make a change, or are frustrated with your current plan and need help, call these guys, 539-205-2147. Call our friends at Chapter. They can help you now figure this out. And they're highly rated by the Better Business Bureau, A+ rating, and they have a lot of 5-star reviews online that you can read for yourself. But here's the deal: they can save you money, they can help you avoid being part of the 90% of seniors that are on the wrong Medicare Advantage plan. So call these guys and get the help. Go to the comment section in this video or the description to this video. There's a form that I'm going to include that you can fill out that allows them to reach out to you and help you sort through your Medicare issues, or get you in a better plan that best fits your budget, best fits your need, and the coverage that you're looking for. You paid into Medicare. You deserve the best plan. You deserve the best services. Let these guys help you get that. So that's all I have for you today. I hope you enjoyed the video and the information that I provided. Let me know in the comments what you think about the overpayment issue that I talked about and the changes that are happening. And until I see you in the next video, thank you for watching.